So guys, we're here with Paul Silovsky, owner of PT and CEO of Rebound Physical Therapy. I'm Nancy Mura, founder of the Private Practice Network and Pizzapalooza. And we just want to thank our sponsors. We forgot to do that last time. Big shout out to Survival Strategies. A bunch of you on here are clients of ours, and we want to say thank you. And Paul is one of our, he's our adult version of Diane. Diane did all of their programs for like 20 some odd years in the pediatric field when we didn't even do peds. And then Paul has been a long-term client. He's another one that has done every single solitary program that we have. So we like to call it know-how. And if you take away anything, especially those of you that were just on, and then you're on this, the thing that Diane has, the thing that Paul has is the know-how. Like these guys, nothing is really a problem in their practice. It's a challenge that they might have to change a condition on, and they've got the know-how on how to confront and change everything. And when I sit there watching, like I did on the last one, like these concerns people have and what you guys have to deal with on a daily basis is mind-boggling. I just want to bring up on the last one, we'll get to Paul and his amazing topic, which has nothing to do with this, but our last one was on communication, how to talk to anyone about anything. And, you know, a thing that is coming up, and I think Molly, it might have been you, this thing where parents are coming in under the influence. Oh my gosh. Yeah, Molly's shaking her head. I mean, Paul, do you believe this? Like, this is something they have to deal with on a way too regular. And I can't believe you have to confront that added to everything else, front desk and no-shows and cancels and kiddos making progress and not making progress and all this stuff, and patience and their consistent challenges. But Molly, what I would say is, I had to address this because it didn't get dressed on there. One, you know, I would just send out not a thing to every single one. I mean, not an individuated thing. I would send out a thing that goes out to everybody that says, dear valued client or patient or whatever. Just a reminder that if you are even suspected of being under the influence, you have to by law be reported. Because in that scenario, you don't have to see them getting high in a parking lot for it to be considered a reasonable observation of fact. So that I would send that out and just remind them and report, because you have to by law. And that's the really, like, some therapists really have back off on that, but it's becoming a problem. So I had to address it. Sorry guys, if that was a kind of a not on topic thing. What is on topic, you guys, is our upcoming event in New Orleans. We have a few rooms left, which means we have a few tickets left. The time is now. I'm going to turn in the rest of the rooms that we have left over, like probably tonight. I'm kind of a little past the deadline, or tomorrow morning. So just know that if you want to come, the time is now. Now, with that being said, if you cannot make it to the live event, what's amazing is that we have the virtual. And I always wait till the very end to see how many tickets we sold, because they make it like almost fiscally impossible to do a live stream from there. It's like one little cable for internet is like, it's like $8,000. We're like, what? We know that you just flip a switch and we have internet. Why are you trying to be so putting us over a barrel there? My goodness. But the good news is we now have virtual. So Carrie Lee will put some links up. I'm going to introduce Paul. I'm going to go switch my desk because this is a Mac and I am like a fish, like flopping around out of water right now. Like I'm just about to be like, if this thing just like cuts off, it's like, because it's a Mac and I have no idea. But Carrie's camera is way better. That's all I know. All right, guys, I'm going to introduce Paul Silovsky. Some of you know him. Some of you already love him. He's a master CEO. We love to bring you people that really do have the know-how and know what the heck they're talking about. So without further ado, Paul, why don't you get to your amazing stuff? And guys, of course, if you have any questions, please get it in the chat and we will get to your questions as best as we can. Okay, take it away, Mr. Silovsky.
Thanks, Nancy, and good morning or afternoon, depending on where you're at. Always a great intro from Nancy. Love working with survival and the private practice network and the Pizza Palooza and right, who knows what they're going to come up with next. So the next fantastic group. So hey, with the size of the group today, I'll make sure. I think I'll definitely have enough time at the end. We can engage on this subject. I'm going to cover it a little bit more subjectively than some people might think of when it comes to quantifying value of service delivered. But at any rate, happy to answer your questions. I'm only going to cover one aspect of this, something that Nancy said earlier triggered something in me, and this is definitely true of this subject, is that anything that you can understand better, or anything you have full understanding of, you can control. And we certainly want to control the value of our services. And I want to just give you a perspective of something that I've been able to implement really over this last year to increase the collectible value of our services by making our staff more aware of all the things that go into making a great valuable activity, not only from a reimbursement standpoint. I'm going to cover it from the non-reimbursement, but it definitely affects your ability to get paid. So that's what I'm going to go over here. So I put some slides together. I'll mow through those, fairly rapidly. And I actually think this one, I haven't done this presentation live. I have a video or a recorded series I do for my staff on this subject of value. But I'm going to give you guys some stuff live, not what I go over with my staff. This is really more for owners and senior executives. But we're going to go over this, and then we can visit the subject of getting paid or reimbursement. If you want to get into that at the end, I can answer any questions about the approach we take, at least on the adult side. But anybody that's using CPT codes, what we're doing really applies. But let me jump in here. Let me do the screen share thingy, and give me a moment to start my slideshow. Okay. I don't know why it's not starting at the beginning. Huh. Give me a second to pull it back up. Oop, I don't want to pull that up. There we go. What drives value? So we're going to briefly look at who really decides what your services are worth. I've found as an owner and an executive and a former treating therapist, I haven't treated patients for a while, but I used to wear all three hats at one time, and it works a lot better for me to wear two, to wear just two. So I definitely have treated for many, many, many years and can understand that perspective. But I want to take a look into who really decides what the service is worth, because that's really the hundreds of thousands of dollar question in most practices realm, because all of us can increase by that amount. I think I really believe that in a year's time you can increase by 100 or hundreds of thousands of dollars by addressing this issue in an intelligent way. But it really comes from that owner, senior executive decision first. You really don't want the public trying to decide for you what the value of your service is, although there's a major engagement there. And you definitely don't want most of your staff trying to, because you'll find quite a varied view of this. So I want to give you a viewpoint or a mindset today, or perspective. I'm going to start out with a definition. I love definitions. I know Nancy and I both love words. We love the power of words and what they mean. And so just through dictionary definitions here of value, we're looking at this first noun one that I have highlighted, but I'll read all of them real quick. It says, the regard that something is held to deserve, the importance, worth, or usefulness of something. And then in a sentence form here, your support is of great value. So used as a noun, that's what we're actually looking at is the noun version, not that first verb version down there, a monetary estimate of the worth of something, right? Where you're looking to value something. You definitely need to do that as an owner, senior executive, and figure out what you need to get reimbursed and what the value of the services needs to be profitable. That's a different hat with maybe another seminar to dial into connecting this to finance. I'm going to go over this worth or value or importance or usefulness to you and to your staff and to your patients. And then there's these principle things on the second noun usage, a person's principles or standards of behavior. That's your judgment of what's important in life, your own rules, your own mores, your own values, those kinds of things. But we're really looking at this first one here is at what level of importance, of what worth does someone place on your services? First you, next your staff, and obviously then the public or the publics that you service. So I think it's it's good to go over that to know which usage I'm looking at here. I'm not looking at this just this monetary valuation of your company or your services per se. That's important. We'll talk about that maybe at the end, and we'll get into the quick Q&A. We can go over that. I'm looking at this first one here on value. In the reimbursement world, I know you can do this, for your own practice too. There's this concept of relative value units or RVUs. Some independent board, in our case for the therapy, for the PT codes and OT codes, for sure, well, all the codes, it's largely determined. We don't have a seat at the table necessarily of how they derive at that. This is not going to be a seminar on that. I do a little education with my staff, by the way, on I show them some relative value units of the various codes that we use and create an understanding of how that's derived at. As a matter of fact, early in my private practice career, the first board position I held for the Kansas Physical Therapy Association was a reimbursement chair, because I figured if I was going to be an owner, I was going to learn all about reimbursement. That's what I did first, and then I hopped over to legislative because I lived in the capital city and I did have some PR technology, and I learned how to hobnob and grip and grin and all that. And I was better at that than I was reimbursement. But anyway, RVUs is a subject that you can certainly dive into, but unfortunately, those importances or those values, relative values, or those significances are derived at by someone else for the insurance contracts, and for sure in the realm of if you're not doing capitated plans anyway for Medicare and Blue Cross and Blue Shield and TRICARE and your state work comps, that's derived by somebody else, but it's still relative, right? It's so funny they call it relative value. It's relative to what, right? That's the big question. That's the $100,000 question. It's relative for all those different publics, because there can be varied opinions on them all. But so I'm going to dive into what you can push in and drive through to make sure that you do get paid for sure by the public, right? So you have the ability to adjust that relative value, even though it's predetermined in your contracts in most cases, or fixed on a financial scale. It's not fixed on what people will pay you for current or future services. So I mentioned this before, there's definitely actions and trainings that you can provide for your staff to increase value, because your staff will come in with their own idea, their own relative value. That's why I put this at the top, because it's not a fixed thing for your staff and for your public. You could have 5 different staff members with 5 different ideas about what the services that you provide or that they provide are worth. So you really need to dial into this, because I'm telling you, if you don't have more people on the same page and level of understanding, what I opened with was anything you can understand, you can control. So if your staff do not understand this subject, they will not control the revenue of your company or their production. I can guarantee you that. I can put that one. I could help anybody on this webinar and their executive staff by diving into just the guys that don't have a good understanding of what the value of their services really are. So you need to provide the education and knowledge for your staff to get their viewpoint and their mindset opened up to this, because it isn't just about this fixed financial scale that's put there by somebody else. So Value does drive your ability to get paid. I'm going to show you a 6-point little algorithm of some things you can look at to improve the skill of yourself and your staff. It is going to be a bit subjective, but you can quantify it, in your own light based on your culture, based on how you guys want to treat the public and deliver and what your professional skill sets are. But my last thing here on this particular slide, ask you guys a question. You don't have to answer it in the chat at this point. So I'm going to give you some other survey questions, but have you ever surveyed your patients or your staff to find out what is valuable to them or what drives value, in your services in their mind, right? And I'll give you a non-patient related example of what I've done with many, many referral sources. One of my favorite questions to current or potential referral sources in building relationships with them is I just simply ask them, what is most important to you in a referral relationship? In other words, what would make a relationship with them as a trusted provider, as a trusted caregiver, and not even for therapy. I even take it off of therapy. I don't talk about physical therapy that much when I go in and do referral source visits, but if it comes up, I'm willing to talk about it. But I'm most interested in what's most important to them in a relationship, and because they're going to tell you what's valuable to them. Okay, it may or may not be anything to do with physical therapy, for example, but I'm giving that offbeat perspective to say, okay, if you went to survey your staff or your patients and find out from them what drives value inside of a visit or a complete plan of care, you might have the key to getting paid better as you go forward. You'll definitely know what to put your staff's attention on when they're working with your patients, and you will know as an owner or senior executive what's valuable to your staff. It may not just be money, how much money they get paid, or for the public, it may not be the prime thing, how much they have to pay, if you really know what the other drivers are. So if you surveyed your staff, what would they say if you asked them, hey, this is now for the staff, what makes your care or services valuable? If you know what they consider to be valuable to the public and for them to provide to another, you can add strength or value to what they're willing to check off of on a charge sheet, or check their understanding of making sure that they're really charging for everything that they are delivering, which I don't know about you guys, but I know in my clinic over the years, and I still have a few of these guys that we're working on in our company, some of them love to, give away services. We have a fair number of Mother Teresas in our industry that would love to just give it all away. But they don't always have the full perspective of the exchange with the company, with the ownership, with their fellow staff members, much less the public. It's great, it'd be great to give away everything to the public, but we still have to pay our staff, pay our bills, and support our support staff as well. And then the second one, what is or are your care or services worth? If you have a better understanding in their mind what you're really up against, what do they really believe or know that it's worth? They obviously don't. Most staff anyway don't have a full perspective of the cost of delivery, what all goes into the cost of the services. So I'm not necessarily just talking about that, but they will have to have some perceived value. It'd be good to know what the perceived value that they have of the worth of the care they deliver or the services that your group delivers. I know some therapists don't even really have a full perspective of what all the additional costs are, much less how much goes into getting one patient to arrive and complete not only a visit, but a complete plan of care. Everything that goes into that, from the marketing to the facility costs, to the executive oversight, the billing collections, all the things that go into it. And we're going to get into the subjective value more here in a second, but it'd be good to know that. And then this one, I've had to really drive home and give actual examples to my staff. Where does your profession rank and pay for the time, results, and value to the consumer? I think the rehab medicine industry is way underpaid and undervalued if you looked at it for yourself and do some comparisons of what, not even other healthcare providers, get paid, but, I just had some services done here at the house and, paying the electrician or the plumber or whatever the guys that come over and do the spot checks and the maintenance work on our house. We have a newer home, so we're still under some warranty contract stuff, but we still pay to keep everything up to speed. And it's amazing to me what they get paid in an hour's worth of time compared to what we get paid to really change somebody's life, and so that's one comparison you can do. But I'll use, because I'm an outpatient orthopedic guy and have had this procedure done to myself. So I had a total knee a few years ago, but and these numbers were from like 17 or 18, but the average cost of a total knee is about 55 grand, and of that, PT is only about 1,500 on a national average, $1,500 of the 55,000 as a percentage. But if you look at the time spent and the value of that outcome for that patient, and you really got your staff to look at your major subsets of delivery, the areas that you deliver in, and what your outcomes really are, and what the value of that activity really is. If you did that and then got that parlayed onto your staff and better understood where it really ranks and how undervalued it is by these, I won't use the word that just came into my head, by these individuals that sit around the table and determine the relative value, right? Now, unfortunately, we signed the contract. So if I sign the contract, I got to play the game. So I have to learn how to leverage that. I know in our company, we have extension of care programs. We have, transitional programs. So, about 10% of our income comes from, cash pay services for people, not cash pay PT, but people that stay on and do, wellness type activities, personal training, group classes, massage, other things that we can keep them connected to our organization. And it works out. I mean, if I just took that financial value, the fact that people still continue on with us past their insurance, we get about $7 per visit more by providing those services. If I were to take those dollars and convert them to how many dollars per visit, our ability to keep people connected and continue to provide value to them. But if you really just did a comparison of where you rank, and then against, I know in private practice where we rank against, this is one that really gets my staff. The hospital, the hospital systems, even the outpatient hospital systems, they're getting paid, somewhere between 2 and 3 times what we get paid on the same contracts, but easily 2 times. So if you're getting $90 to $100 a visit, I don't know what you guys are getting, but whatever that number is, you can pretty much double it at a minimum for, what could be considered the same, or, I'm not going to evaluate somebody else's care. I don't really put my attention on that. All I know is we are the best value in town because of our delivery model and the fact of what it's costing them, just both the combined cost of insurance and patient pay. So you need to do a comparative and get your folks to really look at it, because if they look out into the marketplace, they're going to find that you guys probably are one of the best, if not the best value in town, even if you were a cash service. And then the last question there is, what should you be charging and getting paid? If you really looked at it, while you might be restricted by some of these contracts, having a good perspective of what that value is and what value you provide, and then knowing what you should get paid, and the fact that you really do want to pay your staff better. So once they understand how to achieve that and really have a broader scope of perspective of what the value is, you're going to have a lot better chance of getting more out of that. Okay, let's go to the next slide here. So what are the points of evaluation? I am not going to spend a lot of time on these, because these are the subjective things that people want to quantify and want to battle with you over. I don't engage in this that much. I can have these conversations, but they don't ever go anywhere. So I'm going to just list them. You can add to them, by the way. I'd love to see anything else in the chat that you guys hear. So these are points of evaluation that occur on this subject of evaluating value, right? So you can pick apart time spent, all therapists want more time with patients. Okay, they want more one-on-one time. I know in the outpatient adult and orthopedic market, our schedule, we don't, I mean, all folks get one-on-one time. We don't double book anybody, but there may be a little bit of overlap when someone's arriving and leaving and you're finishing one and starting another, but there was never people that are double booked. But they're all one-on-one, time codes. But there's a lot of evaluation of the clock, and the insurance industry is doing a really good job of selling this thing, selling watches and clocks and counting and coding. We can talk about coding a little bit at the end. The value of money or the cost of something, I wouldn't even get into the debate with staff or the public on that, because it's your responsibility to provide the value where there wouldn't even be a question, which is really the essence of this talk. And the coding and the fee schedules, most of those are already contractually fixed. You can fight over time to improve them, and I definitely encourage folks to work on their public relations with insurers to do that. You can get into debate over charges. Charges are relative to making sure that we're charging for the right codes for us, but that's about it. As you guys know, there's so much in the field of write-ups. Now, patient responsibility, there's not a very good understanding of what patients are really responsible for. While they've paid for that contract with that insurance company, and the contract is with the insurance company, they do have a responsibility towards the copay, deductible, coinsurance. But what's subjective or evaluation points about that is their perceived value. They think they've already paid, so you have to handle that, and I'm going to give you a handling for that. The therapist's responsibility towards appropriately charging, either providing the visits or charge per visit, or the charges versus the completed plan of care. I like therapists to just really focus on completing plans of care, because you're not gonna. I don't get into the visits thing as heavily. We do look at revenue. We talk about revenue every month with our therapists, see their revenue production every month, and we work with them on how to maximize their efficiency with coding and scheduling and charges and whatnot. It's not a focal point. We just focus on providing great care and completing plans of care, because then we're guaranteed that we're going to get paid better if we do all the other things that we need to do as managers. But this is really, we're diving into just this value proposition, right? Insurance companies and third-party payer rules, those contracts, that's really between you and the insurance company and your admin staff. Therapists don't really have to engage in that other than to understand the rules. But they do have to have an understanding of how it impacts the revenue. But I don't like them to get into the significances, because the therapist can tend to get very significant. Can get very significant over these things, and it's better to just have someone checking those things. Now, something that gets evaluated is both the therapist or any staff member, by the way, or the patient's opinions about their experience, which we're going to dive into that one here in a second. Definitely outcomes. You can have patients, for example, the reason I put this one on there, you can have people that show great documented progress, great success, write success stories, write reviews, and then come back after they get a bill and have a problem paying the bill. So your outcomes are very important. It's still subjective even after they've discharged and have a good experience and have objective outcomes. And then I'm interested in any other evaluative factors. We can cover that at the end. You can put those in the chat now if you want to, but I'm interested in what you guys run into that are points of contention, evaluation, invalidation, conversation about things that have an effect on providers in appropriately charging for services, or getting the public to pay for services, or opposition that the public may have about paying for services. Little caveat here. This was actually included in a particular course I did with survival strategies years ago. I actually was trained in the subject of sales. Don't know if they still do this anymore, but I had them come out and do a program for us on the subject of sales. But there's the top 5 reasons, or the main reasons, patients will drop out or discharge in our segment, in our adult outpatient segment. Some form of bad service. One, I know it's a broad concept, but if someone had a problem paying their bill, you could probably do a quick check on these 5 points, check and see if they're happy with the service. If there was too much pain, obviously we get into the subject of pain. We're in the pain business. It's what brings most people in. We certainly use it in our marketing, so we have to be able to deal with it on our delivery. But if obviously if you hurt somebody or overwhelm them with pain, they're not going to want to come back for self-discharge. There are people that do have true financial difficulties or financial stress. Lack of education, in other words, if people aren't really educated up, if they don't have understanding, guess what? You're not going to be able to control them. What I said in the beginning, anything that you can understand, you can control or have control of. And that's true with the patient too. The patient can understand what's happening with their body, with their treatment, with their finances, with their pain, with the schedule, the thing that comes down there below with the frequent change of therapists. If they can understand it, they can control it too, and then they'll be willing to pay you. And then in our industry, certainly frequent change of therapists can really throw people off the rails and not want to come, they'll either drop out or self-discharge. So I'm going to share this pie chart with you. I actually have used this one, I think, remotely in a previous slide. So I'm only showing you this graphic so I can talk about these 6 points. It's actually something I read in an article on branding, but it has to do with this subject of value, putting value into your brand. You can put a lot of value into a single interaction with a patient. This is really, really relevant. These 6 points are super relevant with your therapist, but it's also relevant for you as an owner executive with your staff, because I'm going to rapidly go through I'll just, show you how these things I want you to get a visual on how they interconnect. I'll show you this graphic again later. Well, that's used in branding. I want you to look at it from the standpoint of getting paid. Okay. Look at this from the viewpoint of a great patient experience, extending your value into every interaction with your patients, particularly the therapist. Obviously, they're all going to tell you that they got into the profession for the green dot, right, to help. Every one of these therapists wants to help. But the big three are help, expectation, and observation. I'm going to break these down, how they interconnect. And then those guys connect with anticipation, initiative, and insight. This has a lot to do with your engagement with the patient and or your staff. Because flipping this from a therapist viewpoint to an owner or executive viewpoint, you're there to help your staff. They obviously have expectations. You do too. You better have really great observation skills. Any of you that have done or are going to do a program with survival strategies and scaling up your executive or administrative skill or PR marketing skill or financial skills, you have to have great observation skills. You will get trained right from the beginning on this point. This point of observation is key. My key successful action as a therapist was in my evaluation skills. I was lucky enough to be a PTA first and then go on to PT school. So I went to PT school. I already had a bunch of treatment skills under my belt, so I could focus on my evaluation skills, made me a lot better clinician right out of the gates because I could observe. But these things interconnected, all 6 things together provide the value. So let me give you a brief description of those 6 drivers, okay? On the subject of health, this is the simplest one to close any practitioner or executive towards, is their ability to help an individual public member or a staff member. So that one is not a hard sell. If they're not there to help, then they're not a good fit for your company. But your ability to help and observe what someone else needs help with is really, really key, because that help and observation graphic, when we look back at it, really connects with the initiative. When you have observed enough about what's going on with somebody, whether it's a staff member or a patient, and you have the ability to help, then you can take initiative. You're able to get your butt into action and be super effective, right? And then, whoops, past that one, sorry. Training your observation skills. When you're doing an evaluation, from even before the patient starts, hopefully your staff are observing indicators or, key elements about what someone expects, right? That help, observation, expectation. When you observe enough to know how you can help somebody, you can take initiative. When you observe and ask enough questions, because asking questions is a way to observe. When you know what someone else expects and someone else tells you what they expect, or when you tell them what you expect of them, if you're a manager or an executive, you're going to get a lot further, because that help and expectation gives you that anticipation of knowing how you can help someone. It makes you a super effective caring person because you can anticipate, take initiative, and then you have insight into these things. So I'm going to go back to the graphic here. You can see how they connect. You can observe what kind of help you can provide. You can take initiative. You can observe and know what expectations are. You have insight. The faster you can do this, the greater patient experience you can provide. And you can really handle any objection to someone's unwillingness to pay, because you will run into super conservative people and give them a great experience. And you can move someone out of a conservative state where they just want to hold on to everything and not give it up, right? They want to be very fiscally conservative and give you all the reasons why and really rationalize it out. If you move them out of that band, if you help them, you observe what they need or want, you exceed their expectations, they're going to give it up. They're going to see the value in what you're doing. That works for staff and it works for the public, because you will be able to anticipate, take initiative, and have insight in towards those things. You can see how this works with a brand, but it works great with a patient interaction. If you focus on helping people, meeting and exceeding their expectations, and always observing what's going on with them and not worrying about yourself, which is, I'm sorry to tell you this, guys, but I've seen a few therapists that do this that are more worried about their own schedule, their own self, or some other expectation that they have for the patient, as opposed to exceeding the expectation for the patient, helping the patient to observe and anticipating what they need, taking the initiative, having the insight to do those little extra things. And you'll find that these things that I'm talking about here have nothing to do with time and money. Every one of these things can be instantaneous knowledge or knowingness. Many times it's just asking the question, hey, what would make this a great patient experience? What would make this a great experience? What are your expectations of me as a provider? What do you want out of this treatment? If someone tells me something about their pain or their loss of function, I don't stop there. I want to know what that's going to do for them, because I want that emotional driver that's going to get them paid in that visit, so that then I know, well, I don't have the motivation in that visit getting paid, but I don't have barriers to payment because they have a great, valuable experience. The better your staff understands this and the previous thing I talked about on where you rank in the marketplace, how someone else has already ranked the value of our services so freaking low, so low in the marketplace compared to other services. I've got a son-in-law that used to work for me in Kansas, married my daughter, met my daughter in our practice 10 years ago, or well, he got married 10 years ago, but whatever, 12, 13 years ago. He now lives here in Nashville, where our family's here in Nashville, even though he practices back in Kansas. He gets paid $140 a session as a personal trainer at a club here in Franklin, Tennessee. And he understands this 100% because he exceeds expectations. He knows exactly, he's observed exactly how he can help an individual. And he's not there to provide a training session that's 50 to 60 minutes long. He's there to provide an experience. And he is very much grooved into anticipation and taking initiative, and has full insight into why or what reasons that person would want to be successful, more fit, more healthy. He knows the emotional drivers, and he has no problem getting paid. And some of these people are seeing him 2 and 3 times a week, right? 2 to 3 times a week at $140 a pop. And that's more than most of our therapists are getting paid per visit. I would say the majority, unless you're in Alaska, right, Nancy? That'd be the only. Is there anybody anywhere else that you know other than Alaska that they're getting paid that per visit?
Oh no, Alaska's insane. I swear. It's the only time I ever think about opening up a practice. Who wants to open a practice in Alaska? We'll open up a peds practice and an adult practice.
That's right. That's right. But you guys get my point there. I love these drivers, so because what if you got paid for how much you care, your professional skill, which, there is a skill component inside those quote unquote RVUs, right? But there's all this human relations skill too. They're paying you for the clinical skill. The way you guarantee that people pay you for your full episode of care and beyond, because I had plenty of patients that stayed on afterwards. When I, discontinued my treatment, one of the things that I did to turn over my hat the power of the condition that I was in as a treating therapist is we expanded our wellness and sport performance programs. We found ways to keep people connected to the company and paying us cash and keeping us connected. So we had extenders of care. When the professional skill was no longer needed, it's funny, these people still want to stay on. A certain percentage of your people will continue to pay you cash to stay with your company. You should figure out a way to do that. It's another extension of your value, right? But what if you got paid for the understanding you create? When people understand what's happening with their body and understand how much you care, right, and how you deliver that, they'll pay you everything they owe and sometimes more, right? And if you got paid for the difference that you make, if you really focus on meeting or exceeding expectations, doing the extraordinary, not being ordinary, but being extra or extraordinary, you'll get paid. And then definitely dial into the whole medical necessity and professional skill is a part of RVUs. I won't argue that, but you really need to dial down to what the necessity down is for that individual. When you really dial into that, and you connect to it emotionally, you will get paid. You will not have a problem having people pay you. Matter of fact, they'll figure out ways to pay everything they owe. And figure out ways to stay on. Matter of fact, you'll be trying to keep them, you'll be trying to get them to leave. I've got a couple of really good therapists. Now I've got to coach them on how to transition more people, into those extended care programs and get them off off the insurance contracts, or we're ready to move them on. So what drives value? It's never about time, and it's not really about money. If your therapists dial into those 6 elements, the quality of that time will go up. Your patients won't even have time considerations, because if your patients have time considerations, it's because your therapists do. They're not putting enough probably into the compressed time that they have with someone, and really dialing into what's valuable to that individual, and from their professional viewpoint too, their professional and medical necessity viewpoint of what they have to dial into, and connecting it to that human experience. So while someone else might decide what the insurance company is going to pay you for those codes and those fees, you drive the demand and the value of your services and what the consumer is willing to pay you. So this will help an awful lot if you put together some training and have some deep conversations with your staff. You will increase your ability. I know we're working through. We're starting to hit the downside of the copay or the deductible season, because we're heavy in Medicare. I understand the pediatrics obviously would be maybe heavier on Medicaid, but we have to work a lot harder for that portion. The first 3 or 4 months of the year, we work pretty darn hard for that deductible and copay and co-insurance money. And I intentionally did launch that training in the 3rd and 4th quarter of last year to be ready for deductible season. We've had our highest ever patient pays, and not necessarily seeing a lot more visits. I'm actually recapturing some staff. We had 3 people out on maternity and lost a few people, and they're coming back now. So we actually saw a few fewer visits in the 1st quarter, but our gross income was higher and our patient pay was much higher than it's ever been, because we're driving the value of the activity. So all that said, you do have to learn to play that game of correct coding initiatives and charge diversity. I'll talk about that in a second, or units per visit if we need to. You do have to understand that as an owner, you'll get a lot further by getting your staff to increase their value first and drive that into the patient care interaction. And they'll have to demand it. First you demand it, then they'll have to demand it of themselves. You'll find there's certain indicators in the patients that really drive your ability for them to be super happy, have their expectations exceeded, and have an increased willingness to pay you. I'm not saying that every patient pay experience will be seamless. It'll just be really hard to combat it when they have that great value add experiences. So you're increasing the value of the services delivered. We obviously look at that every week. I look at that total. One of our main statistics, I look at I used accrual-based accounting, which is what was the value of the service delivered in the week that we're in, because we know what we're going to get reimbursed. We have great prediction of that. We calculate within 1% of what we actually collect. We collect within 1% of what we project our collections to be on an accrual basis, not on a cash basis. And so while I look, that's one of my big three things I look at. I look at how much service got delivered, but you have to work on your staff to have a good understanding that they're worth actually more than they're getting paid. They have to work hard in order to get paid what we're getting paid. We have to work, have a bigger think than the amount that we would expect to get paid, right? We have to buy the insurance companies. But, so the more that your staff understand the value of the service delivered and how to legally maximize that with coding, again, I can answer questions about that here in a moment because I'm about done. You're working on the staff's mindset and the patient understanding because those are the things that that drive value the most. Those will get you paid, particularly as long as you're doing ethical billing. I know you don't have a problem with it. For many years, we were way under billing, and I know last year it was one of the major things I worked on. We were able to get we work on off of units. We were able to get our units per visit up by 0.2 of a percentage point for the whole year, but for the last half of the year, it was more than that. And it made a big difference in how much we got paid per visit for doing the same amount of work, because we were leaving money on the table. And in my mind, it was a bit unethical because we had staff that were undervaluing our services and really just didn't understand correct coding initiatives. I can talk about charge diversity and correct coding if I need to, but I want to answer any questions first. I knew I'd get this done early, Nancy, so we have time to chat. Don't see anything in the box right now, but happy to answer any questions on this. And I can definitely talk about what we've done coding wise and or with our charge diversity with what we do. Because I don't know how many adults we have on here, but I know I think most of the peds are still working off of CPT. Everybody's working off of CPT codes, so it just may be a little more fixed in that realm. So, any questions, Nancy? I'll open it up if you want to lead that part, but happy to roll through this. I knew I'd get this one done early.
Yeah, I know that value conversation is like, yeah, you're really right. I mean, electricians make more money than people like actually making people well. It's why we love this. It's why we love this profession, because we feel like we can help you guys, kind of get around that in certain ways. Like if you knew how many niche programs Paul has and how he's all set up, like he just is not at the mercy of that in some regard. He did the best to build that out. And that's what I always tell people, like, you can't have all your eggs in one basket, So that's my take on it, unless you move to Alaska, which we do. Paul, do you know our clients? And we have two in Alaska. We have Kelly Comstock. She's in Ketchikan.
Yeah, I know Kelly, and then I know there's some hands-on diagnostic guys up there too.
Oh yeah, and then we have Bill Wise is up there, but I think he's in Anchorage. He's like there in a major Ketchikan. I saw some video on it the other day, and I was like, well, it is beautiful. Yeah, and a lot of fresh salmon. Mm.
Yeah, it's right there on the coast where Anchorage is obviously inland there, but
it's beautiful. It's yeah, I can't believe those reimbursements there are just, there's a couple of states that do have, it's really, what's so crazy? I don't know what it's like for peds, but in New York, where the rents are so suppressive, the reimbursement is so unbelievable. Like they're just going to beat you to death. Like, I don't know how you can get around that. I mean, if you're adult PT, getting the diagnostics part is really helpful,
Well, yeah, to get your collectible value up for the time spent. Obviously, there's a pretty good runway to the certification training, but Not as much for ultrasound, but definitely for EMG and NCV. But well, hey, if anybody on here, do you have if there's something you run into, happy to do a little two-way communication here on that. If there's something you're running into with establishing this concept of value, if you have questions about coding and charge diversity, I'll tell you a viewpoint on it, but not so much. I can't get into, obviously every geographic area has different valuations, relative values that have been assigned for value of your services. There are ways to look to maximize that. I mean, happy to answer any questions on that, or just take a scenario and talk it through with you. I can do that now, or you guys, I'm always willing to chat with anybody independently too. I know for us, just dialing my staff into using the right codes, not just based upon what they're paying, but I used that I said something about charge diversity. It was really funny. Our therapist got into the habit of charging certain things that weren't really reflective of the diversity of services that they were providing. To give you an example, most all of our patients come in with a pain problem, a mobility problem, a strength problem. They'll have some functional deficit that might be either balance or proprioceptively based. The list goes on, right? So you might have a list of 3 or 4 problems, right? But they'll use 2 codes. And while we'll come in and we might do some soft tissue work or something to work on their pain, which could be 2 different codes, and we do something for mobility, and then we do, so we got the manual therapy code, we got something to deal with pain, we have something to do with mobility, something to do with strength and or function. You could get into 4 or 5 codes very easily, but typically 4. And that's what I mean by diversity. And the diversity of the coding can maximize your ability to get paid. And our therapists were so fixed because we're 50% or greater Medicare, and they use the Medicare Rule of 8s, which most everybody's aware of, right? Or the guys that are doing the adult side of it would be Medicare for the pediatrics. They get into this 8-minute rule, which is really a total number of minutes provided of service, but it's different. That's 50%. We are locked in and have to follow that, but the diversity of the coding makes a difference. Which codes you use make a difference. You want it to be an accurate reflection of what you're doing. So that's what I mean by charge diversity. And then the second part of this is then half of my public are not on the Medicare fee schedule and are not subject to the Rule of 8s, so that you can't get pigeonholed into charging the same way, meaning you might be able to do it. If I did 4 different things for 8, let's just say I did 4 different things in 40 minutes, we'll schedule on a 40-minute time frame on the average for an established patient. But it's pretty easy to get 4 to 5 different codes, or you get easily 4 time codes for every one of those patients. And if you charge them like a Medicare patient, only did 3 codes in a 40-minute visit, you're leaving 1 complete code out. So my point, that's how we were able to increase by 0.25 or 0.3 units over 50,000 visits. Makes a big difference. It makes a huge difference. So what we're getting paid now looks a lot better than what we got paid a year ago by focusing on the value of service to the diversity of what we were doing and not undervaluing. Our therapists were way undervaluing what they were doing, not only in the physical realm, but in the experiential realm of dialing into, doing the right things with folks. And they were personally undervaluing what they were providing. And we had, we still have a couple of the, nothing wrong. I've had no hard knocks on Mother Teresa. I'm just saying, when it comes to, charging for your services and providing a great experience, when they realized that it was easy to move those mid-level guys that just didn't have the full understanding. It was easy to move those guys because they really understood the value of what they were providing, and their collectible value went up. And since they get paid or bonus, they don't get paid off of the revenue, they get bonus off of, delivering more valuable services every month. Man, those guys are just, they're nailing it. They feel good about it because they know they're still getting paid, particularly compared to the hospital system or some of the corporate contracts. So anyway, that's my brief summary of describing charge diversity and how we look at coding, because we have someone looking at that. Don't trust me, we have someone looking at it every week, and for the overliers and the underliers. I'm not just looking at people that undercharge, I'm looking for anything that gets miscoded or overcharged too. So to keep it ethical, to keep people on task, you know, because go ahead.
Hey, oh,
Nancy?
sorry. No, wrap up that. No, I just want to. I just wanted to answer a question that Elizabeth put in the chat, and we're running out of time. I don't know who jumps off at exactly the hour, but go ahead, finish your. I don't want to.
No, it's fine. No, I'm done. I'm done.
Oh, okay. Okay, cool. So Elizabeth said, how do you train your new staff to achieve good patient communication? That is a task, and I will tell you, there's some stuff to go on that. We do role playing. Good. Do you have specific indicators in your evaluation paperwork that drives the therapist to respond appropriately? You know, Elizabeth, being that you are a client, you know that there is every couple of months, I'm not on that side, but you know, there's the communication course. You know about that? That is really rigorous training. And even if it's just you getting trained on it, that you could go back and do that. That's a really good one to make if you can. I know they're going to try to add on more days at the next event, which is October. That has people out of the office quite a while. But if you can, they are going to try to offer it in that Palooza like a couple of days after. But those communication courses are no joke. They're real nuts and bolts, and they get you there. But part of it is, a lot of you guys are survival clients, so you'll know what I'm talking about. And those that you don't, it's in the keys to private practice success. There's types of staff that you wanna hire to begin with, and you want to start getting trained in we coined this phrase, on the bus, off the bus, at the first Palooza, like who's on the bus, who's off the bus, and we're pretty kind of brutal about it. There's 3 types. If you read the keys to private practice success, there's 3 types of staff they go over. And thanks, Carrie Lee. And the one that you really have to just get your mind wrapped around, you cannot have, is the defiant negative. They usually come with other problems besides being people that say no to things, and they can never make a problem. They can never solve a problem. Like you go, well, what if you came in 20 minutes earlier? No, I can't do that because I have to walk my dog. Well, what if you stayed? What if you put this in on your computer with a Post-it? No, I can't do that because, and they just have an excuse. The defiant negative will just kill you. They will exacerbate you. They don't unlearn that. It's not like you give them the data and they go, oh, I'm a defiant negative, I'll stop doing that tomorrow. They just don't. It's part of the thing. So you want to look at certain key aspects like affinity, reality, and communication. You want to look at how high their affinity is, what their communication, how high they communicate. Like, I think you guys can tell, like, I'm a high communicator. Like, you ask me a question, I'm not going to sit there and think about it for 20 minutes. I'm going to answer you. I'm going to engage. I'm going to ask you a question back. So you want people that are really good communicators. And then you want to look at that tone level. You want to look at, like, are they antagonistic? Are they cheerful? Are they enthusiastic? Are they in grief? Are they always negative? Are they always optimistic? Like, that says a lot about how they're going to be in your practice for a very long, as long as you have them. So there's things at that base there. But then, but that role playing is really crucial, Elizabeth. I would definitely keep doing that, drilling. Give them scenarios. Have them mock up being on a phone and a client says blah. What do you say to that? And then I don't know, Paul.
Yeah, I'll make a right. Yeah, I think the drilling, let me look at what you wrote there. Yeah, the role playing is awesome. I think having at least a checklist of things that you would want to make sure that they include in that evaluation, because that is the observation step. That is the major point of observation. Matter of fact, we're training. I re-recorded a thing for, I call it the 10 keys to a completed plan of care, it's all about the eval. I go through these points, these touch points with the patient. It goes over the concept of what or a couple of the concepts that Nancy's going over of really acknowledging, fully acknowledging everything they say for sure. But this point of expectation that I made, if you get your staff to dial into what that person expects out of the experience, what they're really going for, it's just one of the 10 keys. But there's points that I learned in my training with survival that helped me build that 10-point checklist. So you just have to put the pattern there so you make sure that they're checking the boxes, because there's a number of things that you have to check on. Remember, everybody that's coming in there is comparing you to something, at least in their mind. And if you don't know what that comparative is, this is one of the points on the checklist, what their past experience has been with therapy or like therapies. And, they might have a fixed idea on that. That's another point. I've got to know that. I've got to know what they expect. Those points that Nancy pointed out there, those points of affinity, reality, and communication, like what the communication is flowing like. It's, how the communication going is a point of observation. How engaged this person really is. Are they bought in? And so you build that into your script on how you want them to conduct the evaluation so they don't miss anything. Because I created my 10-point list after watching other people and seeing the points that drop out, or listen to collection calls. If you want an indicator of what's really going on in your company, listen to the person that has to handle an upset person or person that doesn't want to pay their bill. You'll find one of those 5 points out. It could be bad service, I see lack of education most of my company, by the way, particularly younger therapists. They haven't had the patient up. They haven't put the patient's hat on. Patient is not responsible for the care. I tell my patients when I treat them, like, look, I'm pretty good at they get the idea that I was pretty confident that I say, look, I'm only as good as you work hard, right? I can only work as hard as you work is another way that I put it, right? So, but not every therapist is going to dive in, at the same level. So you got to get them committed to that patient's goals or expectations. But anyway, I'm giving you parts of the points of my checklist, but you could make a pretty simple script or checklist for getting someone through an evaluation. And it's all about observation and communication and meeting or exceeding expectations for me to get them through, get them committed to the plan of care. Go ahead, Nancy.
I love meeting or exceeding expectations. It's interesting because I don't know how you handled it along the way, but sometimes people will look at me and say I'm perfectionistic, right? And some people can view that as really hard to be around or work with because they want to kind of have this attitude of GE, good enough. And I don't live in the good enough world. I do not live in I feel like if I was a practice owner, I'd be like, let clinic across the street be good enough. We want to exceed expectations because to me, that's the only way. Why be in business? Why offer a service? Why? Just why? If you're going to be GE, let GE be good enough for something else, like a course you got to take that you just need CEUs for. And you're like, you know what? I got a B on this, or I got the passing score. Who cares? You passed. Your kid gets their permit to drive and they barely passed by one. Okay. It was good enough for. So I put value on things that I deem extremely valuable. And you know what? I'm going to tell you right now, my team so understands my perfection and they're right on board with me. They're right on it. When I'm upset, we had something get sent out the other day that had some typos in it. And I couldn't recover. I'm going to tell you honestly, I could not. Carrie Lee, could I recover? No, I could not recover from this. It was like this person went out there and stabbed 15 kittens in front of my face, because that's the level. And you know what? She came back out to me with how she was going to handle it, what she did to put in to never have that happen again, which is a condition. So she was following a condition that was a danger condition that she went into and she recognized on her own. And I just think you got to have what Paul is saying. You have to have that that level of expectation, and you have to constantly communicate it to your staff in a way that they're on board with you on that. And you can do that. And if they're not, that's a off the bus, or unless they have like a ton of other skills, like you can take somebody and be like, wow, they're so not a front desk person. Like as a front desk person, I want to kill them. I want to kill them. But you know what? They might be great at calling up on collections, not because they're super snotty and mean and invalidating and like, I don't care that you couldn't pay your bill. That you wouldn't want that. But if they were just sort of like at a tone level that resonates as what's called no sympathy, it's just like, I don't know if you've been around somebody with no sympathy, but you're like, oh my God, I broke both my legs and I lost my job. And they're like, yeah, that's tough. And you're like, oh my gosh. Now that's the kind of person, she acknowledged me, but she didn't fall for that whole like sympathy, like, oh my gosh, like that's free everything for you, broken leg lady. Like, no. So you can't take somebody else's great characteristics and put them into another department that they'd be more suited for. But again, that's back to observation. And that's why we're like always harping on getting trained, because when you're just putting out the everyday fires every day of like normal stuff, like I don't know what to do because I got 3 gals out on maternity leave, that right there, you can't think in that creative CEO realm. So I think you have to get yourselves organized enough that you can really go into like a super hyper vigilant observation mode and then make policy according to that. But guys, we've stolen your time. Like we've stolen your time, like
Your valuable time.
your valuable time. We think that we hope that it was valuable for you to be here today. And as always, a big thank you to Paul Silovsky. Guys, if you haven't gotten the Keys to Private Practice Success book, there are some like just to like, so you don't have, we like to have that exchange in abundance. We are redoing the book for the pediatric version. Right now it is an adult version, and it does have some outdated websites, blah, 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 blah. But the content does not change. We just redid the whole book, and none of the content changes, not even by like 1 drop. So all that stuff is in there. If you want to really learn about the 3 types of staff, you want to get that book. If you want to read up on how to hire, get that book. If you want to learn about communication, get that book. It really is a bunch of, very important pillars. All right, guys, I'm going to let you all go do what you do best. Paul, thank you so much. Carrie Lee, as if you're not right behind me. All right. We're so silly here. All right. Thanks so much for joining us, guys. And if you have any questions, we're always available. Please reach out, and ciao for now.